Thank you. So I'm just going to introduce the presentation with just a quick overview of the practice at the centre. We're one of the very few centres in the country that operate on pectus deformities. We have one lead thoracic surgeon that completes both the Ravitch and the NUSS procedures for both the Pectus Excavatum, which is your sunken chest, and your Carinatum deformity, the pigeon chest. Post-op management from a physio point of view is just looking at standard airway clearance, lung volume recruitment and mobility to aid a safe discharge. Prior to January 2015, patients then referred on to their local MSK physiotherapy service. Just because of the MSK nature of this operation, they were referred on to their local centre for further input. So both myself and the lead thoracic surgeon found quite a few numerous problems with referring them back to their MSK centres, which then was having an impact on their recovery and obviously the post-op outcome. This was mainly due to the local centres not having a huge amount of skills and knowledge to treat this client group. They often refuse referrals, which was due to local funding, but numerous reasons, again, mainly due to sort of skills and knowledge. They also only provided one follow-up, so they were given their initial appointment and then they were asked to progress independently. But also the main thing that we found, we were getting them back into clinic with the thoracic surgeon and they had poor functional outcome that caused increased upper limb strength, reduced upper limb strength, increased back and shoulder pain, and then obviously that's leading to poor posture, and then obviously a poor surgical outcome. So between me and the lead thoracic surgeon, we actually identified the need for more of sort of a close follow-up in-house review for these patients instead of referring them on. So we needed someone that had got increased sort of experience and knowledge of the management, which obviously then was coming from the in-house centre. So what we've put together is a outpatient clinic. We run it once a week just because of the small numbers of patients that come through every year. We felt once a week was substantial. We see them at 3 months post-op. This is to allow for any tissue healing and related post-operative precautions to have ended. We can see them before, so we've had quite a few patients that have had poor outcome after the surgery, so they've needed to see us before, so we can obviously do that. And we're able to see them for numerous appointments if that's needed. So these are the treatments that we offer, and it is dependent on the patient's needs. So postural correction and retraining, range of movement exercises and strengthening exercises, manual therapy if it's indicated, the kinesiotaping, the review of surgical precautions to make sure that the surgeon's happy that they're allowed to start progressing, and then lifestyle advice. So retraining them how the chest wall moves, improving their cardiovascular function as well. So this was just sort of the statistics that, so before 2015, where the cardiothoracic surgeon only operated on 8, which none of them obviously then were referred on to us, they were referred on to their local centre. In 2015, when we first then started the new clinic, we operated on 16, 13 of which were seen by myself or my colleague. One received telephone advice because that was their choice. One still was referred back to their local centre, again spending quite a lot of time with that local centre explaining what they can't do and what they needed to be doing. And then one patient actually declined physiotherapy input altogether post-op. And this is just to give an overview of sort of the clientele group. And as obviously you can see, it's more younger adolescents and with a male dominance, and you can see that in the research that's done with the Pectus deformity as well. And again, just looking at the geographics of where our patients are from, so you can see we actually are quite spread out over East Anglia, and actually our patients are willing to come back to us even though they're quite far away to get the specialist input, and obviously the service is supported fully by our thoracic surgeon. So although the service is still fairly new, the initial benefits that we're seeing is improved communication with the thoracic surgeon. So if anything, any problems are identified by myself or the surgeon, we can review this really quickly. Obviously, myself and my colleague, both senior physiotherapists, have got specialist knowledge and experience in rehabilitation of these patients. We've got the continuity of the care, so we see them post-operative in hospital, and then obviously we're following them out as an outpatient as well. And then we've got close links to other professionals such as your radiologists, specialist nurses, tissue viability, which we've found through the patients over the last year. This has actually been really helpful to have these close to us and able to sort of use them as needed. So in terms of evidence with physiotherapy post-op, the evidence is very small. There is a very limited amount of research out there, and that's not just for the Pectus Correction Surgery, but that actually is for any thoracic surgery, apart from your normal post-op management, your airway clearance, your mobility in terms of discharge. There was one study in 2000 in the Netherlands that actually found that if there was a problem that physiotherapy can fix, then it is actually a positive additional treatment that we should be using. And this can be seen with our pectus. So we know they're going to have poor posture, and they might have had this for many years. So actually, if we can see a problem, we should be treating them. In terms of evaluating our service, we're using a twofold evaluation. We're using a subjective postural questionnaire, which is pre-op, so the patients do it before they go for their surgery, post-op immediately, so when we see them after their surgery, and then at their 3-month follow-up with us as well. This is to evaluate the improvements after surgery, but then to see the improvements from surgery and then after physiotherapy as well. And this is done on their body image and posture and sort of how they feel their surgery is gone, and then how physiotherapy has helped. We're also doing a patient satisfaction on discharge from the clinic, just to see how we're doing, seeing if there's any further developments that we need to make to the service. This is just a posture questionnaire. I've just added it in. It just purely goes through how they think about their posture, how it affects their daily life, their hobbies, their mood, etc., just so that we get a good knowledge of what actually we should be targeting to improve them, and that's the satisfaction questionnaire as well. So in terms of further development for the clinic, obviously we're going to, this is our first year, so we're just starting to audit it now for the 2015 patients. Going to audit the patient satisfaction on the Pectus Clinic. We're obviously going to make a comparison of the patient's posture and sort of body image perceptions pre-post and then physiotherapy intervention. We've identified the need for obviously a more randomised controlled trial to study the effects of physiotherapy pre and post. And then obviously the outcome of these then identify any further service needs that that we need to have as part of our physiotherapy service. So thank you for listening. Any questions?
Thank you very much, Liz.